Good morning, everyone, and welcome to today's webinar on building community wealth for better social care. My name is Maddie Kortenaar. I'm the marketing director of the Social Value Engine, and we offer a digital platform that makes it easier to measure and evidence social value. So a few notes before we get started. This webinar, as you can see, is recorded. We will share this with everyone after the event. Towards the end of this webinar, the speakers will answer audience questions. So if you have any questions, just put them in chat or in the Q&A at any time. Then it is my honor to introduce today's speakers. We've got the lovely Helen Allen. She is the Director of Community Enterprise at Community Catalysts. We've got Steve Latham-White, and it's quite a mouthful, so apologies, but it's the Interim Lead Commissioning Officer in the Commissioning and Contracts team at Wrexham County Borough Council in Wales. And we've got, Ivan Annabel, the Director of Social Value Engine. So let's get started, and Ivan, it's over to you.
Oh, thank you very much, Maddie. I'm delighted that you said you were honoured to introduce us. I don't quite know what I've done to deserve that level of gravitas, but
you didn't get a lovely though, Ivan. I got the lovely. Sorry.
I know. Well, yes. The truth cut in very quickly, didn't it? But I'm going to speak for around 15 to 20 minutes about a social value perspective in relation to this theme, and I'm the sort of aperitif really then to hand over to Helen and Steve to really get into the nub of the very innovative approach that Helen's organisation has pioneered and Steve's organisation has exemplified in relation to the whole social care agenda and a progressive and alternative addition to current orthodoxy in relation to it. But before that, I will just share my slides and take you through the background to the Social Value Engine, why we're excited and interested around this theme, and a bit of information about how you can engage with us going forward should you be interested so to do. So I'm just going to share my slides. If Maddie could give me the heads up if they do occur and they can be seen.
And they can be seen, but you're not in presentation mode, Ivan.
Yeah, well, how about that?
Perfect.
Okay. So I think community wealth building, and this is a slightly different spin on it because it's about building community wealth rather than community wealth building, but the two things really reinforce each other, is a really interesting and contemporary context. And I know that in Scotland particularly, the whole agenda around community wealth building as a context for social action is really important. And I think the idea of linking community wealth building with social care is something which isn't necessarily for those who are close to it innovative, but I think brings a sort of deeper strand to that whole part of the agenda than perhaps has existed initially with its focus on local economies. And I would argue very strongly that health is a key part of the whole context of the way local economies operate, and quite often, particularly in rural places, is an anchor, a key thing that really helps with the functionality of local economies. That's not to say it's exclusively a rural thing, and I'm very pleased we've got some people from big authorities in terms of their geographies on this slide, as well as rural authorities and also other organisations interested in the agenda. So Social Value Engine itself is now 10 years old, and we use it around the context of this notion of a triple win, which is where local authorities, VCS bodies and health agendas in the context of today's discussion meet. And whilst the private sector is very important as a key player as well, and we've got these rather three nice pillars in this visual that's been developed, we think that the whole interplay in the context of this social care agenda, local authorities, PCS and health commissioners is really at the nub of an exciting agenda that can improve people's lives, make places more sustainable, but also, importantly, make them more prosperous. So in terms of the social value engine itself, it's been established to enable people to measure the impact of their different interventions. And there are 3 key words set out in the second bit of this slide, which really have informed the way that we've gone. And we've worked quite closely with community catalysts, but as I'll come on to say, more widely around the whole agenda in terms of health and social care, to provide a tool to measure impact based on those 3 key words: a simple approach, transparent approach, and an accurate approach. And they're 3 useful watchwords for a Monday morning to have up our sleeve when we think about the importance not just of doing things, but doing things well and being able to demonstrate the progress we've made. In essence, we do that, and increasingly there's legislation in all 4 countries across the UK that seeks to do that around measuring social value. And that's around valuing the invaluable. That's a nice little catchphrase, isn't it? But ultimately capturing the essence of what we describe as community well-being. And I think the reason, particularly post-pandemic, that this has become such an important theme is that there's an understanding that with relatively slim amounts of money available, and then the things that have happened since the pandemic around the cost of living crisis, money needs to be spent not just well, but in a way that builds the capacity of local places and local communities. And that's very much the nature and tenor of the way that the health interventions that are going to be described a bit further on in the seminar work and operate. But measuring that can be quite complicated and difficult, and that's where the social value engine can come in. And I love this slide, largely because it talks about complexity, and complexity isn't always a bad thing. Sometimes we want to oversimplify things and we miss nuances and the importance of things in localities when we do that. And so what the social value engine does is it seeks to take a whole range of local circumstances and provide a framework for measuring them. And where it can be implemented across what we might describe as an ecosystem, that might be in the context of what we're talking about today, where commissioners and organisations delivering contracts have a common set of measures and a common understanding and a common means of analysis. It can drive out not just good measurement, because measurement's just measurement, isn't it, but actually good and invigorated and self-reinforcing outcomes. And we all know, because there's been a discussion for a number of years now, that social value is important, but people have struggled to really find a way of measuring and communicating it. And so in the way we've developed the engine, you can use it to go from the things on the left to the things on the right. So quite often people still use convoluted spreadsheets. And just think about that in the context of delivering social care. You know, that's a long way from the practical experience of somebody on the ground. Lengthy manual assessments, which actually involve lots and lots of one-to-one narratives and discussions. And whilst they're important, and case studies are particularly important, they can really sap all the life out of trying to understand and measure the impact of something important. Or at the other end of the spectrum, there is what I might describe as the charlatan's agenda. So there are some people out there who will just tell you that you just need to give them the data and they'll give you the answer, without necessarily explaining the origin of what they've come up with. And we call that the black box approach, because ultimately you have to trust their brand to believe what they've told you. What we've always believed, and it's posited on the things on the right, is that if you can give somebody a fishing rod and not a fish, you can train them to be able to simply and straightforwardly, with a tool like this, measure impact. And you can do it in a way that also involves people who are the recipients of services. So there are 8 key principles that Social Value International say are important, and 2 of them are about involving people and taking action. And we've really based our approach to measurement on those 2 key things. And the way the engine works is it provides a financial proxy, that's a source of information with value on it, that can be ascribed to different activities. And then it follows a treasury formula, and it's all programmed. You put in the volumes to actually enable you to work out the value of what you've achieved, and to also express it as a ratio. And because it's accredited as a tool, it provides the ability to deliver something which has credibility with third parties, and it's the only piece of UK software that's accredited by Social Value International, which is the global body based in Liverpool, but global, the global body that convenes over 40 countries that have different forms of legislative commitment to social value. And we have 120 local authority and VCSE customers, and they are spread, because from day one we've been committed to this agenda, across the whole of the United Kingdom. So for those people who are listening from Scotland and Wales and Northern Ireland, it's not something which has been developed in England and then just given a bit of a spruce up to make it seem relevant in other countries. It's founded in this notion of the importance of context and the importance of local measurement. And as part of our commitment to the whole process, viewers from Wales will be pleased to know that financial proxies we use will soon be available in Welsh as well as in English. So that's the engine in big picture terms. Moving on to how it relates to this whole agenda, and looking firstly at the key principles of community wealth building. If you talk to my good friend Neil McInroy from the Centre for Local Economic Strategies, who defined this principle in the UK, he imported it in part at least from the States. These 5 things are the key principles that underpin community wealth building, or in the context of what we're going to hear from Helen and Steve soon, building community wealth through the lens of social care. But here we've got things that potentially are quite tricky to measure. So we've got plural ownership of the economy, making financial power work for local places, fair employment and just labour markets, progressive procurement of goods and services, socially productive use of land and property. All that stuff really speaks deeply to me and my personal values, but you'll be pleased to know that because we're very attuned with this whole agenda of local empowerment, we've developed a suite of things that help us to measure the impact of activities around those themes. And through the lens of social care and working to support people to live independently for as long as possible in communities, I would argue that agenda can be shaped to deliver against all these things. And we have the tools through the financial proxies and the social value engine to measure the impact of these things. So just to give you a flavour of the sort of activities that we've used the engine in the context of that speak to this agenda. We've used it heavily to look at the impact of social prescribing in a number of settings, particularly in England and in Northern Ireland. Recently, we did a piece of work with a fascinating community-led recovery coaching initiative, which works with people who've got all sorts of dependencies and challenges in their lives, and it's very powerfully shown not just the social but the economic impact arising from that. We currently have a contract with the Scottish Government to work with 19 local authorities that are delivering the community-led local development programme, and there are a number of health-related initiatives that have arisen out of that, from everything through to physical exercise to imaginative use of village and community settings. And we've used the engine really actively across over 400 projects over the last year to home in on the outcomes delivered by those local authorities on the ground, funding small scale but important potent initiatives all the way from the Orkneys through to the Scottish borders. And so there's some really powerful examples in there that speak to this agenda. We've been actively involved in a number of projects which seek to generate patient involvement, particularly people who are receiving ongoing care in community settings. We've used the engine to measure the impact of that, and also to measure the impact of schemes which help people return from hospital to the local community and often into a care setting. And then, most interestingly of all, potentially, since COVID, there's been a huge growth in clinical trials at primary care level. And we've been actively involved in this whole process of thinking about how you can measure the impact of some of that work, because that's led to a far greater inclusivity, not just in terms of the range of people who participate in clinical trials, but also in relation to the way that those trials are delivered, and delivering them on the ground in different challenge settings speaks really nicely to the broader agenda of also working innovatively around social care. And I just wanted to finish with an example of what that looks like. So a few people who know me will be bored of me talking about Mablethorpe, so I'm sorry about that. If you don't know me, Mablethorpe, in addition to being the poet Tennyson's favourite holiday resort, is an isolated settlement on the Lincolnshire coast with a population of 14,000 people. And through Towns funding, we were able to generate 8.6 million to invest in this building, which has this very dynamic group of people standing outside of it, which is called the Campus for Future Living building. And that will host, once we've got it up and running, a pipeline for the recruitment of new local care workers in that geography, working with Helen and Community Catalysts. But it's also brought together a whole range of other uses linked to clinical trials, continuing professional development, some actual clinical procedure delivery via the GP's practice, which is next door, to create a real hub and an anchor for the local economy, and something that will actually support the growth and development of a new sector with longevity and good quality jobs in this environment. And so we're using the social value engine to measure the impacts of that, the social return that will be delivered. And we've set up an approach which will enable us over time to not only derive a sense of the value that's been delivered, but also to work with the local community in a transparent way, using that measurement tool to engage them in the process of ownership and shaping the ongoing strategy for what we're delivering. So, without further ado, I am going to end our slideshow, end the share, and hopefully pass on to Maddie, who I think will then pass the baton on to Helen and Steve. And I think we're going to pick questions up at the end, aren't we, Maddie?
We are indeed, and yes, we are playing a game of tennis now, but it's indeed over to Helen.
Okay, can you see that? You see that, Maddie? Yeah.
Yes, sorry, yeah.
Brilliant.
Yeah.
Thank you. Really great to be here today. Thanks. Great to be doing this jointly with Ivan and Maddie. We at Community Catalyst have bought the social value engine. We're really, really keen to evidence the social value of all the stuff that we do, which I'll talk you through a little bit of what we do. So we actually do a fair amount of stuff. People may have heard of local area coordination. We host a network for that. We've got a website called Small Good Stuff. We host a coalition for personalised care. But today I'm going to talk to this symbol of communities care, basically. So just a bit of background about us. We are a community interest company. We set up in 2010. We've got lots of experience in people-led social care and health. We celebrate the strength of people and community. And we think people, community, care, it's all pretty much a big, wonderful mess. You can't put it in boxes and what have you, and it's wonderful and messy and creative. But public services tend to work in structured boxes and silos. So we're all from the world of care. If we asked our loved ones, what help might you need as you get older, the choices are pretty limited. People would probably think of care home, domiciliary care at home, daycare. But actually that isn't really going to help people to get a good life. So here at Community Catalyst, we like to work with a mess of people and communities. We've always had a foot in community and with local authorities. Our background is shared lives, or adult placement, as you may have heard of it. We set up due to the personalisation agenda in England back in 2006, which was very much about helping people have more choice and control over their lives. That's great, but if the choice is only take a direct payment, which was the vehicle for enabling people to have the control, take a direct payment and employ a PA, personal assistant, that actually doesn't really create choice for people. So essentially, Community Catalyst, we're a capacity building organisation. We have core expertise, allegedly, that's me, but we have a local presence. So everywhere we work, we've worked in about 75 areas, currently about 28 areas. We have a local presence. We have a local person on the ground, a catalyst or a coordinator. What they do, I'm just going to move you there. They help local people who want to do something for the community to think about what they're good at and then start their own business or enterprise that offers care and support, but in really, really creative ways that give older people and disabled people a choice of how they're going to get the help they need and the control over their own lives and how they live it. So the definition of community micro enterprise, the micro bit means they're operating either as a sole trader, 1 all the way up to 8. We want to work with the smaller little enterprises based in communities, rooted in those communities that want to help people, but they just don't know how to go about it. We don't work with franchises. They can buy kind of packages off the shelf. We want to work with Helen, who lives in Sandy Lane in Romley, who wants to help a couple of people. The enterprise bit, actually, they can be a sole trader. They might offer their service on a community voluntary basis, all the way up to KICs, charities, co-ops, businesses. So we actually cut across a lot of silos. We cut across the VCSE sector, we cut across business, we cut across housing, social care and economic regen, which has come more and more to the fore, really. So my background is absolutely care. It was when my boss asked me to go to an event on community wealth building. I thought, what on earth is this? This is nothing to do with what I'm doing. And then it's like, oh my God, light bulb moment. So the first bit, I'm going to tell you about what we do and then how it kind of fits with that community wealth building. So this is a slide. Hopefully you can see this well enough. So I talked about choice and control. As you can see, those are the boxes at the bottom. So Community Catalyst, we're on the right hand side there. We want to link with local people who are interested in providing services or support to other local people. Now that can be anything. That can be opportunities for people with a learning disability in the day, rather than going to a big standalone day service. We have enterprises that provide amazing support for people. For the purposes of today, because we've got limited time, I'm going to give lots of examples of people who've set enterprises up that can help people within the home, that back up kind of the traditional care. Brilliant that the people that we link with, a lot of them are economically inactive. So, for example, in Kent, we linked with Amy. She was a mum. She'd had previous care within home care, but she'd stopped working to bring her family up. She didn't want to go back to that traditional way and wanted to do something in her community. So we supported her. She set up a little enterprise called East Kent Care. Down the road from her is a lady called Connie. She's retired. She has a background in supporting people with a disability, and she needed a little bit of extra something to top up her pension. Again, she wanted to support people locally. So she set up Connie's Companion Care. No personal care there, but more kind of that whole life, good life stuff. We linked with a lady called Naomi. She'd come from a corporate background, and she set something up called Mrs. Organizer. It's all about that mental health, decluttering, helping people to sort their lives out. Her service is saving the council in her area thousands of pounds, because they were paying massively big corporations to go in and clear people's homes, not taking into account people's mental health and what have you. Last one, we do work a lot with people who are, we work with JCP, Job Centre Plus, people like Ellie, who was on Universal Credit. She'd worked with as a family worker in the past, but for her own little mental health issues, she had to give that up. Coming back, she wanted to help people in a local community. We helped her set up something called Unique Support for Unique People. And she's offering people new experiences, hobbies, getting out for the day. So we're helping those people to set up enterprises that they've got an interest in, rather than expecting them to fit into the very narrow social care sector. We want them to disrupt the status quo a bit. So the bit that we help, well, actually the next box in the green, they've got to know how to run a sustainable enterprise. We give a lot of advice around HMRC with sole traders, but if somebody wanted to set up a KIC or a voluntary group, we signpost to the CVS, to business support organisations, and we work really, really closely with them. So that's always a great partnership. The biggest box that this is where we come in, our USP. They've got to understand the rules and know how to offer quality care and support, and that's us, CQC or Care Inspectorate Scotland, or wherever we are in the UK. We've got to understand those regulations, because there are exemptions for people to work in a different way. HMRC, all that stuff. They've got to know what supports will be bought. So quite often people come and say, oh, I'm going to set up a registered dom care agency because my gran had awful care and I want to do it better. And it's like, actually, that's not what the council's wanting. It wants more small, local, flexible, responsive services. So that's where we really, really guide people. People have got to really trust the supports that they want to use, because often if they're not regulated by the regulatory body, people feel very unsafe about using them. It's a massive culture shift. So we've developed some standards. We call them the Doing It Right standards. And our local catalysts that I mentioned earlier, they have an advice framework. They take people, they handhold people through this approach. It's got everything in there that you'd expect, that the entrepreneur's got a DBS, they've got public liability, they've got the right training, as well as having lots of other working in asset-based ways, that they're not going to let people down, that they've got a contract and they work to that contract, that they work in professional ways. And that's our USP. We get these people to really understand them so that they keep themselves safe and the people that they're working with. Over on the other side of the bridge, we've got people who need help to live their lives, older people, people with a learning disability, people with a disability. They've really got to understand what they want and need. And we know that quite often people just expect the same old status quo that are related to. So we have to work with link workers, community connectors, social workers, village agents, carers, people, hospital discharge teams to say there is another way. Fantastic. We've got the bigger traditional, but we want people to know there's some smaller local options where they live. They've got to understand what they want and need. And crucially, they've got to have the money to pay for the support. So some of these enterprises charge, some of them don't charge. They've got to be aware of the different supports that are available, information. And we have a website called Small Good Stuff, where the enterprises can advertise what they're offering and people can go and look on there. But they still need help to make those choices. And that's where these advisors that we work with, that I mentioned earlier, are really important to us. And we do a lot of work with councils to get social workers and all those teams to feel professionally safe to be creative and use the stuff that we create, because otherwise we've got enterprises on one side of the bridge saying, right, I'm here, where are all my customers? And there's people on the other side of the bridge saying, well, I need some support, and we have to connect that. The bit that opened the eyes, I think, in terms of the money flow, and opened their eyes to kind of more about the economic regeneration of this type of approach, is when people could have the direct payment. They really were customers with money. They really were a new market. And I think that's when the ears and eyes about economic regen really saw that actually there is some opportunity within the social care world. So that is all my world. Oh, that is our website, which is brilliant. And then, like I say, I was asked to go to this event about community wealth building. I thought, oh my goodness, this is going to be so dry. But then it just clicked with me about that whole, it was like, this is what we're doing, about reorganising wealth in the local economy from the bottom up, making it more socially, environmentally just, reorganising local economies to be fairer, stopping wealth flowing out of our communities, towns and cities, and putting it into the hands of local people, so our local entrepreneurs. Reducing the extraction of wealth, making it more nourishing, where all assets have local roots, putting communities first. Heard lots about anchor institutions, and I guess we work mainly with councils, but we do work with lots of those as well. Trying to get folks to change procurement, think about local, think about social value. I also heard about bringing economy back home to people, communities, streets, home, hearts. And it's like, oh my God, this is everything that we do. This is what these entrepreneurs are doing. Recognition that small equals innovation, community rooted. What I heard was lots of focus on encouraging good employment, absolutely, but less on reference to self-employment. And I felt that that's where we had a real opportunity to bring forward more about what micro enterprises do. Coming back to our world a little bit, home care, that massive sector for councils, but procurement generally favours the big provider, which extracts money from the local communities. It could be a massive dom care agency that is 200 miles away, but they're covering that area. Direct payments now is a way for individuals to really become the commissioner and contract with those small and local supports. And community micro enterprise in the care sector is having a massive impact. We can see that. So they help public money to stay local. It's going to Helen, that lives in the area of her local council. People are really connecting and contributing to the councils. It's a new type of role for people in the care sector, which traditionally is really poorly paid. People now can work for themselves, they can be their own boss, they get a better income, and they can work flexibly. So they're getting a better hourly rate than working for a dom care agency, but it's still cheaper to the commissioner. And then we've got environmental benefits. So the people we're working with, we absolutely encourage them to work hyper locally, so they're not travelling across a borough. The children are having less time in nursery as people cut down on the travel, spending more time working, therefore earning, and more money to put into that local pot. We worked with Neth and Barrow Cadbury to bring forward more about the economic benefits of micro enterprise. And it is a huge sector. The workforce, there's 1.5 million. It's bigger than the NHS, a massive sector for the foundational sector and the economy. And if we can support them and provide this invisible scaffolding, then we're helping more people live the life they want, whilst also supporting people to earn a really, really good living through running their own little enterprise. And what the report found was that micro enterprise helps to spread a form of entrepreneurship that's accessible to and benefits a wide range of people, particularly older women looking for rewarding, flexible work. So again, people who might be retired that need a little bit of extra. Creating roles that offer more autonomy and control. So more enterprises, entrepreneurs, were feeling less stressed and anxious since setting up the micro enterprise rather than working for somebody else, and not having that control, not being able to provide the care in the way that they want to provide it. We know that there's massive problems in the bigger sector of keeping people in care, but actually our approach is keeping people in. So 35% of the enterprises would be unlikely to be working in social care if they'd not set up their own enterprise. People leaving dom care, going to work in massive supermarkets where they can work around the family, they're paid more, but actually setting up their own enterprise gives people more of that control. And that more personalised care by devolving decision making to people needing and those providing support. So we've been doing this up and down the country, like I say, in about 75 areas, mainly in England, but we've been working about 8 areas in Wales. And we started in 2021 with Wrexham, which was a fantastic opportunity, bang in the middle of COVID. And I'll let Steve now I'm going to hand the baton over to Steve to give the Wrexham experience. Over to you, Steve.
Thanks, Helen. So yeah, I mean, I think we're all in the same position, and as Helen stipulated, we started this during COVID. The plans were in progress before COVID was announced. We were just very fortunate that we got into that position, and I think across the country there was a decimation across our social care, domiciliary care offer because of demand challenges and people retiring and leaving the workforce. So this gave a really clear opportunity for us to diversify the market and support our ability to support our health colleagues and our citizens to receive the care that they wanted. And I think it's important that it is about managing demand in the fact of having a diverse offer, but what we get with this is the added value of person-centered approaches from that delivery, because when we have the feedback from our citizens and from the providers that are delivering, that ability to go that little bit over and above for somebody, to provide them with, you know, a hot meal as part of their provision because that's what they want to do, that's what makes this all completely worthwhile, and understanding what the difference is between a domiciliary care agency and a micro enterprise going into someone's home. And I think it's just vitally important that we do consider the well-being and the social value and the community well-being and the impact that this has on carbon reduction by trying to keep people local, but also that network and community development that comes from it. These are micro enterprises working in small communities, well known, developing their reputation, which is where their business comes from. And I think it's absolutely pivotal to supporting people with direct payments, because one of the main challenges for people with direct payments will be, from our perspective, the fact that they do have to employ somebody. To be an employer is an important challenging legal position to put yourself in. With this, you're commissioning, which means it is a contract between the two of you. You pay the bill at the end of the day. You don't have to worry about them going on holiday and things along those lines. They develop their networks amongst other community micro enterprises to support each other through those networks. You can have more than one, but you get to choose as an individual who is entering your home. Whereas with a domiciliary care agency, it could be any worker that's coming through at that time. I think the most important thing for me from a local authority perspective is this was taking a risk at the time. Yes, it had models across different parts of the county, but Wrexham has never been the most innovative. But we took that risk with Helen's organisation and pulling it together. We worked collaboratively. This wasn't just a case of come and solve our problem. It was come work with us so that we can develop a solution to the problem that we've got in our area. And I think that's been the most important factor in feedback between the two of us as a local authority and a provider, is to go, the reason it's worked well in Wrexham is because we worked together. It's a partnership approach in developing the economy that we need within our council. It has seen some cost savings. It has seen improvements in our economy wider than social care. A lot of the people have come from disillusioned backgrounds of working in care, and they really want to do it, but they don't want to work for an agency anymore. This has given them that opportunity, and that gives us that quality care retention. People have come from unemployment where they've gone off and have children and come back from maternity into this section. I think it's really giving people choice and control from an employability as well as a delivery angle. We've been able to see significant savings in delivery costs, and I think what you're seeing on the screen at the moment is probably less than what it actually is if we were to properly delve in and look at the wider opportunities of what the private market is also adding into this, because people having private provisions of care, we don't want them to be disadvantaged by this. And I think the micro enterprises provide an equitable service, whereas sometimes within private market they will charge more for private purchases. And I think having the standards and the social value element of what Community Catalyst bring to the table really make sure that those enterprises deliver something that is hugely positive but equitable across the community. And we have seen a significant number of enterprises with good sustainability, and some of those have gone on to considering opening up a domiciliary care agency, which is absolutely fine in the right circumstances, but they've got that sounding board with Community Catalyst to understand whether that's a viable option for them. Is that something they really want? Do they actually understand what the ramifications of that are? And I think that's been quite a useful opportunity. You've also supported some community interest companies and charities to consider whether they would want to go and enter into the markets to support individuals as well. So I think it's been quite a social change and a really positive development for Wrexham, where people really do have choice and control, and having that cultural change within our social work teams as well, which has been heavily influenced by Community Catalyst working with us and coming in and championing the values of what we're trying to achieve. If I missed anything, Helen, that you wanted me to
No, I think that's brilliant. So I can't see you now.
Otherwise.
All I can see is that screen. But absolutely, and like Steve said, I think that system change and culture change is massive. If we can't get the money to flow from direct payments to the enterprises, then actually they wither, because there is the self-funder market as well. And I think that's probably one of the biggest challenges that we have in working with councils, is getting the money to flow via direct payments. The legal framework is there, but I know in England we're seeing that direct payments actually we're going backwards. The numbers are reducing. So lots of work there, and I think that was brilliant with Wrexham. We actually agreed a new rate, didn't we, Steve? So yeah. Personal assistants were paid a certain amount, which was pretty low because they're seen as employees. I'm not saying that's right. And then there was the commission rate of the bigger providers. And we were able to say, well, actually, these sole traders, they're working for themselves. They've got additional costs. And we were able to agree a fair rate with the direct payment. That meant that there was more opportunities for people to enter that market. And you reach a critical point where they start telling their friends about it and their families and what have you. Where we have the difficulties is where we don't get that traction. We don't get the throughput of work. The social workers, it's just easier to commission from the bigger providers, and they're not willing to think creatively and look on Small Good Stuff, our website where people go. But I think in areas where it's working, we've got to have that strengths-based joint approach, focusing on assets, strengths, not deficits. That real partnership, I think that's what we had in Wrexham. Real respect and trust, seeing it as a shared endeavour. So we weren't on our own, because one person in an area, what our catalyst, can't do it. We've got to kind of have that buy-in from the council to do that, and ultimately strong leadership. Able to hold the vision and really kind of address those issues when they come up. So we run workshops with social workers, and quite often we'll bring in an assistant director or a director who have to kind of almost give the permission to workers to think differently and to use the people that are there. In Somerset, where we got most known for, I would say, and I think somebody is here from Somerset, which is great. So we started, I trundled down on a train, as we did in those days, in 2014, and we employed an amazing guy called Reese, and he took our model, all our tools, resources, and we worked together. And everything there that I just mentioned, that real strong leadership, strengths-based approaches, working with social workers, absolutely kind of solidified this approach in Somerset. So after 5 years, there was over 480 micros. What happened after just to say, our usual approach is a 2-year contract, but quite often, as in Wrexham, we get extended for a 3rd year and a 4th year. In Somerset, our catalyst was tupied into the council, and it's carried on. So 10 years on, they've probably got nigh on 1,000 sole traders now, really supporting that home care support in amazingly rural areas. So just after 5 years, there was 400 odd, 380 jobs created, which again just shows that real economic impact, and lots of people using them, and the hours that were being used there. Massively helping with hospital discharge, that person-centred support. But in terms of the figures, 500,000 savings for adult social care per year, and 2 million to the health and care system, which is obviously a massive impact. Oh, that's it. I'm at the end of my slide. So I'm going to stop sharing now. Yeah. So we learn from each other. We have what's called a shared learning network. So we bring all the councils that are working with us now to learn together, which is fantastic. We are pretty good at measuring the numbers of jobs, volunteers, hours, and all that. What we are really keen about is measuring more of that that social impact and the social value, which, like we said, are using Ivan's tool to do that. So I think that's probably enough from us. And are we moving to questions, Maddie? I feel like we've spoken at you all for that long.
No, I mean, first of all, thanks very much. I thought it was extremely interesting, and I think what appeals to me is it's not quite killing, two birds, one stone. It's actually, well, I'd like to say I don't want to kill birds, but it's killing quite a few birds with a stone, isn't it?
Absolutely.
It aids employment, it improves care, it strengthens communities, it enables local investment. And we've all seen, anyone who deals with social care in the big corporates, I shan't take a stance, but they do get an awful lot of profit for their directors or their shareholders, and that's how I believe. I don't think money should be flowing into the hands of shareholders. It should be flowing into local communities.
Absolutely. Absolutely. And these people are value driven. One of our Doing It Right standards actually is that people charge a fair price for what they're offering. So we wouldn't want, in Wrexham, for example, there was a very rural area, wasn't there, Steve, where the Dom Care, because of COVID, was struggling to carry on delivering. What we wouldn't want was 3 individuals thinking, oh, great, well, there's a clear need here. We're all going to start charging £30 an hour for care because there's nothing else. So actually, we, as part of our program, people have to sign up to our standards, and we support them through. Then they self-declare. But a big part of that is that they're only going to charge a fair price for what they do. I think what we haven't kind of shown here, we've got loads of videos and what have you of enterprises, which are fantastic. If people can look on our website, like I said, there's lots of enterprises offering creative stuff for people with a learning disability. So not in building based, it's in communities. It's helping them to connect and contribute to their communities, with some fantastic examples there. And I guess from when we started back in 2007, actually, which was the Department of Health project when we first started, there's loads of enterprises in Oldham, which is where I started. They're still going now. So in terms of that sustainability, we're absolutely kind of, that's a key for us. So I know still there's Funky Fitness and Fun, there's Choice Support Transport, there's Pulp Friction, there's Pathways to Opportunities, and they're still going. And the great thing is they are then helping other enterprises. For us, we connect them, and it's that self-perpetuating. So I think we start from that collaboration. We don't start from that competitive tendering approach that councils usually start with. It's all about collaboration. And I think somebody's put there about the value. It's going to the people. It's not going out to, like you say, those shareholders. Anything else, Steve, you'd say on Wrexham?
Well, I was just going to say, from your perspective, you've utilised micro enterprises yourself, I know, for your own purposes, and I think that's a testament in itself, in the fact that this isn't just lip service where we're going, oh, it's amazing from the aerial view that we're looking down at. We get down to the ground level, and we actually understand that it is a good value service because we utilize it ourselves to deliver for our own families. And I think that's important to just emphasize, that this is quality, and it's that person-centered approach that really adds that additional value and trust.
I'm glad you mentioned that, because I have got when I said earlier that community and care is messy, like Steve said, I used a lady called Anne-Marie for my dad. He's sadly died, but she was able to help me and my niece care for him at home. She worked for herself, and just last week we did a fun run for the hospice, and this is her after the fun run, and she became a massive part of our family. My mum and dad are both died now, but she lives locally. She lived 2 minutes from my dad, and he didn't need any personal care until probably about a week before he died, and she was able to stay with me, with my niece. We kept him there until 3 days, until he went into a hospice, and she was amazing. She was our eyes and ears. We had WhatsApp groups to say, right, when the hospital appointments really kicked in, and she charged my dad £17 an hour. If we'd gone with, I won't say who it is, an agency that is very good in our area, it was £30 an hour. That's massive. My dad didn't get any help from the state, but when he got a carer's allowance, attendance allowance, you know, we could up Anne-Marie's hours, and absolutely, it made such a massive impact to our lives. And we see it. If we had more time, we've got so many case studies to share from entrepreneurs that say it's the best thing I've ever done. I encourage everybody to do it, or from people benefiting from their work. It's huge. I think we've just got to be better at shouting about it a little bit more and putting it out there.
We've had some feedback.
Sorry, Steve, go on.
Sorry, I was just going to put one point across that's similar. We've had some really good feedback from our unpaid carer provider, because we commissioned for our unpaid carer provision in Wrexham. And for carer breaks, it's been a really important element to utilise the community micro enterprises for the unpaid carers, because it's a case of, especially when people are living with dementia, the consistency and that trust that you need to develop within that provider is really, really important. But to not go, oh, day centre, they can take you out, they can stay with you in your home, they will do something of interest to you. You've got more choice and control about what that person coming into the home is doing. And we're seeing much more uptake of that offer, and a real value coming from it back from our citizens to go, this is really helping me to take that break and continue to be an unpaid carer, which is what we need from a local authority standpoint, selfishly, because of our budget challenges.
Definitely. I've just popped, so every area where we work has what we call our small good stuff page. We're increasing the functionality of that all the time. So that's where the enterprises can absolutely market what they're doing. We push it through social workers, through the media, for people to say, if you want something, go and have a look on small good stuff. I'm really trying to get people to think a little bit of care early, which was what we did for my dad. You know, he didn't need care, but Anne-Marie was amazing support to my dad, and she was with him for 6 years. And it was, at the end, it was absolutely amazing. It was amazing all the way through, but at the end. So now people can go on small good stuff and have a look on there and ring round those that they think, you know, speak to 3, 4 and go with those that you get a connection with. It's not all about what's written or their training. It's actually who do you connect with is the biggest part of it, I think.
So we'll move to the questions. I was going to say, I live in Scotland, and we have this big agenda on letting people live independently in their own homes for longer.
Yes.
For very obvious reasons. And I think, you know, what you're doing is, you know, it just supports that so much, doesn't it? It really enables that. But I shan't give my personal opinion, as I'm just the host today. I'll move to the questions, and actually it's one from, I'll just go top to bottom, but you know, the first one was actually for Ivan from Ben. Regarding one of your favorite topics, Mablethorpe. Does the new hub also support training and development for care workers as well as health professionals?
That's very kind of Ben to say that. It will do when it's open. It's due to open relatively soon, and the project that we're working with Helen on, which is seeking to recruit people who'd be interested in being self-employed care micro businesses, will have a hub in that centre, and the idea is that it'll be able to create an interchange for all the other different activities there, because as Helen said, positive messiness in terms of this agenda is a good thing. And I think if you can actually create an overlap between different people providing services which are all about health and care in a community, all sorts of good things rub off. So I should have just said in really simple response to that question, yes, but thank you.
Thank you, Ivan. And I'm moving on because we only have 6 minutes left. I think this is a question for Helen. Have you worked in Scotland and Northern Ireland, or is it mainly England and Wales?
It is mainly England and Wales. We have worked in Dumfries and Galloway. That was back in 2014. We did a little bit of work in the Highlands, which I loved, seeing the cows up there. We've done a little bit in Fife, but essentially that's probably the majority. So we would love to open some doors. I think we thought Scotland was going to be a massive growth area for us, and then Wales kind of took over. Like I said, we've worked in about 8 local authority areas in Wales. It's been absolutely fantastic. So, but yeah, we would love to kind of do more in Scotland. Yeah.
So yes, I was going to say that. So Lauren, I think there's certainly huge appetite, and I said, you know, at Social Value, we're pretty much a mixed bunch anyway. And I would love to have Community Catalyst available where I live in Fife. So please do get in touch. Paul is running a community equipment provider called MedEquip. He's keen to talk to people. He's already working with Community Catalysts, has been a real joy. So well done, Helen and Pip. But we need all to work together. I think that's really, it's not really a question, but it's a really interesting point, isn't it? Because if you do enable micro enterprises and individuals, they might need equipment, they might need digital tools, they might need upskilling. So it's definitely an ecosystem. Is that right?
It is. And I think in areas where we're working in Kent actually, and they're really trying. What we have to be really mindful of is that we are not seen as a separate thing. There's this Community Catalyst project. It's about we are part of self-directed support, personalisation, and actually we've embedded much more together now. So it is about people getting a direct payment. It could be a personal assistant, it could be a micro enterprise, but on top of that, we are working with the team that's over the tech. So hi, Paul, I've not worked with you, but Angela obviously has. And it's about that three-way. What tech can help? How can that help people? What support might they just get from the community? What might they get from a micro? And really enabling it, like you said, that care ecosystem to just galvanise and come together.
Thank you. And I think the next point is kind of mixed, and it's probably worth its own webinar, to be honest. Because we have Sharon asking like, okay, well, local authority will only provide, self-employed PA rate. John then adds, well, yes, but micro enterprises shouldn't be for profit. What's your? I know this is a loaded question, but what's your stance? Can a micro enterprise, an individual providing care, should they be for profit or not for profit?
Shall I take it?
Well, let's Steve answer that one.
Just because it kind of hits us with the local authority perspective. I mean, we undertook that exercise with Community Catalyst to understand that there is more cost to provision by somebody in a CME because of the fact that they are actually running a business and needing to advertise. A PA applies for a job as an employed and doesn't need to have insurance. The insurance, the employer covers the insurance. So the breakdown that Community Catalyst did was based around that, and it really honed in on not making a profit but making sure that all costs were covered, and it wasn't a negative position to be a CME versus being a PA because there is more responsibility. I think, should they be able to make a profit? Well, it's a challenging one, isn't it? And we've got the rebalancing care agenda in Wales. So I would say that the national thing is no, nobody should be making a profit out of social care or health. But at the end of the day, is it profit or is it part of their retirement moving forward? So we all have a wage. Is it based on exactly what we do, or do we get a little bit of extra potentially? It depends on the role. Is that a negative? I wouldn't say so. They've got a plan for their future, the same as everybody else. And the more people that have that money to support themselves in their older age, the better for the general overall economy.
Absolutely. And it's a win-win really. It's so much more cheaper than the bigger providers. It's an offer to people who can't employ a personal assistant, because that will often put people off taking a direct payment. But the individual is going to get slightly more, like I said, we're only talking 17-ish pounds. It's still cheaper than your biggest, the big providers really. So, but it's all about choice, isn't it? It is really about choice. But we do work a lot with the councils to absolutely try and see that they are in the middle. They're not PAs. They are running a business and they've got those extra overheads. Just to say as well, in some areas, Wrexham being one of them, we've had some little pots of money that help the startups, which is fantastic. So from that economic point of view, 250 quid, I think it is in Wrexham, Steve, isn't it? Yeah. We manage the pot, and that's enough for people, because we very much keep your overheads down. Don't go and get an office. Don't go and get fancy uniforms or what have you, because actually, who does want somebody rocking up in a uniform with, I am now receiving care on it? But 250 quid, it can support them to get a DBS, to get their insurance, to get some training, to join memberships, to buy some policies and procedures and what have you. So, and the marketing. So that is a really good little boost to get these people up and running.
Thank you so much, Helen, Steve, and Ivan. We do have more questions in chat, and by all means, keep them coming, or feel free to email me. But what we'll do next is I will share the recording of the webinar with everyone. There's a few people that couldn't attend today, so they'll be able to watch it back. But in addition, we'll go through all these questions and we'll provide some more, some more detailed answers. So I see some more questions going, but please, by all means, you should have my my email address. I'm the one who's been emailing you. It's maddie@socialvalueengine.com. So please keep an eye in your inbox for an email either later this afternoon or tomorrow morning. But for now, I wish to thank our brilliant speakers. Really enjoyed today's session, and thanks so much for sharing your insights.
Brilliant. Thank you.
Thank you very
us.
much, everyone.
Bye for now.
Bye.
Take care. Bye-bye.